Welcome to our NPTE Question of the Day series, presented by Typical PT. Today, we are going to be discussing a question from Typical PT's platform. Let's jump right in. The question is, a pregnant woman reports to pelvic floor physical therapy for pre-birth guidance. During your educational session, you place a pillow under the patient as shown in the picture. What is the primary purpose of positioning the patient like this? A. To promote optimal fetal positioning. B. To avoid downward forces on the uterus and pelvic floor. C. To prevent orthostatic hypotension. D. To prevent inferior vena cava compression. Go ahead and pause the video right now, think through the logic, and lock in your answer. When you are ready, hit play again to see the solution. Welcome back. The correct answer is choice D, to prevent inferior vena cava compression. Before we break down the explanation, I want to mention that the infographic shown here is from the Physical Therapy Essentials book from Typical PT. You can find this diagram and other helpful resources inside that book. Going back, answer choice D, to prevent inferior vena cava compression, is correct. The positioning shown in the picture, where the patient is lying supine with a pillow or towel placed under the right side of the pelvis to tip the patient slightly to the left, is an adjustment used for a patient in the supine position during pregnancy. This adjustment helps to alleviate compression of the inferior vena cava, IVC, by the growing gravid uterus. Compressing the IVC can impede venous return to the heart, potentially leading to supine hypotensive syndrome, a drop in blood pressure, and dizziness. By tipping the patient slightly to the left, this positioning helps improve venous return and reduces the risk of this syndrome during supine activities. The infographic under the section Do's and Don'ts for Pregnant Women states that after the first trimester, 4 months, supine lying greater than 5 minutes is contraindicated because it can cause hypotensive syndrome. The recommended sleeping position is to maintain left side lying, also known as the left lateral decubitus position, for this same reason. Now, let's look at why the other options are incorrect. Answer choice A is incorrect because the primary goal of the positioning shown in the photograph is to prevent IVC compression, not to influence fetal positioning. Promoting optimal fetal positioning often involves other techniques such as maternal positioning during active labor or specific exercises like pelvic tilts. Answer choice B is incorrect because the primary goal of the positioning is to prevent IVC compression, not specifically to avoid downward forces on the uterus and pelvic floor. It is important, however, to discourage breath holding and activities that induce the Valsalva maneuver to minimize stress on the pelvic floor. Answer choice C is incorrect because the primary goal of the positioning is to prevent IVC compression, not specifically to prevent orthostatic hypotension. To avoid the effects of orthostatic hypotension, it's important to instruct the woman to rise slowly when transitioning from lying down or sitting to standing positions. Now that you've gone through this case, take a moment to jot down all the key points in your Typical PT digital notebook. Use it to organize your notes, highlight concepts you found confusing, or mark areas you want to review later. This feature isn't just for note-taking. It can serve as your personal reviewer, helping you track what you've mastered and identify topics you still need to strengthen, ultimately improving your retention and understanding. Thanks for watching today's question of the day. We're dropping new NPTE prep content every single day to help you pass with confidence. Follow us on Instagram, Facebook, and TikTok at Typical PT for daily study tips, quick reviews, and motivation to keep you going.